In my previous lecture, I have discussed the use of thioamides in the treatment of hyperthyroidism. Today in this lecture, I am going to explain the effects of iodides in hyperthyroidism. The two important effects are Wolff Chaikoff's effect, and the second effect is Jod Basedow's phenomenon. Also, I will be discussing the therapeutic uses of iodides in the treatment of hyperthyroidism. Now, a quick recap on the synthesis of thyroid hormone. The follicular cell has a basolateral membrane and an apical membrane. At the basolateral membrane, there is a transporter which is known as sodium iodide transporter that facilitates the entry of iodide into the cytoplasm of the follicular cell. Now, once the iodide reaches the apical membrane, there is presence of thyroid peroxidase enzyme. Thyroid peroxidase enzyme is anchored to the membrane and it catalyzes the oxidation of iodide to iodine. So, iodine is formed and iodine in turn combines with the tyrosine residues to form iodotyrosin. This in turn undergoes coupling to form T3 and T4 hormones. So T3 and T4 hormones are stored in the colloid. They are attached to thyroglobulin molecule and it is stored in the colloid. So oxidation, iodination and coupling is responsible for the synthesis of thyroid hormone. The anterior pituitary secretes TSH which acts on the follicular cells, and in presence of TSH, thyroglobulin molecule to which T3, T4 and iodotyrosin residues are attached, it undergoes endocytosis and it enters into the cytoplasm of the follicular cells. Now once it is inside the cytoplasm of the follicular cells, the thyroglobulin molecule undergoes proteolysis in presence of lysosomal enzymes, and this causes release of T3 and T4 into the circulation. So the release of T3, T4 into the circulation occurs by the process of proteolysis in presence of lysosomal enzymes. In this way, T3 and T4 hormones are released into the blood circulation, and iodides inhibit the release of T3 and T4 by inhibiting proteolysis by the lysosomal enzymes, thus inhibiting the release of T3 and T4 into the circulation. The effect occurs rapidly within few hours, and therefore iodides are preferred for the treatment of acute settings such as thyroid storm because it rapidly decreases the thyroid hormone production by inhibiting the release of thyroid hormones by the thyroid glands. Now let's understand what is Wolff Chaikoff's effect. When the thyroid gland is exposed to large doses of iodides, the intracellular concentration of iodide in the cytoplasm increases. Now, when the iodine concentration increases, the thyroid hormone production is also expected to increase because the thyroid hormone synthesis is dependent on iodine. But the thyroid gland has an internal regulatory mechanism. Through an auto-regulatory mechanism, it controls the synthesis of thyroid hormones by inhibiting the enzyme which is thyroid peroxidase enzyme. So the thyroid peroxidase enzyme is inhibited through an auto-regulatory mechanism of the thyroid gland, and this happens in normal individuals. So there is inhibition of thyroid peroxidase enzyme, and we know that thyroid peroxidase enzyme is responsible for oxidation, iodination, coupling and the synthesis. So the synthesis of thyroid hormones is inhibited, leading to a decrease in T3 and T4 levels, leading to hypothyroidism, and this effect is known as Wolff Chaikoff's effect. So Wolff Chaikoff's effect occurs through an auto-regulatory mechanism of thyroid gland in normal individuals due to inhibition of thyroid peroxidase enzyme, leading to decreased T3, T4 levels, leading to hypothyroidism, and this occurs in response to large doses of iodides. So large doses of iodides induces hypothyroidism through the inhibition of thyroid peroxidase enzyme. Quick revision of what is Wolff Chaikoff's effect. Wolff Chaikoff's effect is characterized by a decrease in T3 and T4 hormones, and this is induced by large doses of iodide. So large doses of iodide induces hypothyroidism, and this is known as Wolff Chaikoff's effect. This occurs because of inhibition of thyroid peroxidase enzyme that is responsible for synthesis of the thyroid hormone. Now this inhibition of thiroperoxidase enzyme occurs as a result of auto-regulatory response of thyroid gland because of its internal regulatory mechanism, and this happens only in normal individuals where the regulatory mechanism of the thyroid gland is intact. So as an auto-regulatory response, there is inhibition of the thyroperoxidase enzyme in response to large doses of iodides, and this decreases the T3, T4 levels to control the thyroid hormone levels in the plasma. But this inhibition of thyroperoxidase enzyme is temporary. After few days to weeks, the thyroperoxidase enzyme is once again reactivated and there is resumption of T3 and T4 hormone production. So T3 and T4 hormone production once again resumes, and this is known as thyroid escape. So the thyroid escapes from the inhibitory action on the thyroperoxidase enzyme, and there is once again resumption of thyroid hormone synthesis. So the iodides produce antithyroid action through inhibition of release of thyroid hormone and through Wolff Chaikoff's effect that induces hypothyroidism. But because of thyroid escape, the action is short lasting, it is a transient action, and therefore the iodides are used for short term management, particularly in acute settings such as thyroid storm. So now let's see what is the mechanism for thyroid escape. In presence of excess iodides, there is down-regulation of sodium iodide symporter, and because of down-regulation of the sodium iodide symporter, there is a decrease in the intracellular iodide concentration. And once the intracellular iodide concentration normalizes, the inhibitory action on thyroperoxidase enzyme is lost. So the inhibition of thyroperoxidase enzyme is lost. The thyroperoxidase enzyme is relieved from the inhibitory action and is once again activated, and thyroid hormone production resumes. There is restart of thyroid hormone production, and this leads to thyroid escape. The thyroid gland escapes from the inhibitory action of thyroperoxidase enzyme after few days to weeks. So the effect is transient, and this is the reason why the iodides produce a short lasting action because of thyroid escape, which occurs within a period of few days to weeks. Now let's understand what is Jod Basedow's phenomenon. Unlike Wolff Chaikoff's effect, which induces hypothyroidism in response to large doses of iodides, in Jod Basedow's phenomenon there is hyperthyroidism, and this is induced by iodine. So there is iodine-induced hyperthyroidism. So what are the risk factors for Jod Basedow's phenomenon? This occurs mostly in individuals with pre-existing iodine deficiency. So long-lasting iodine deficiency causes starvation in the thyroid gland. The thyroid gland is hungry for iodine, and when large amount of iodine is exposed, is introduced to the thyroid gland, there is rapid synthesis of T3 and T4 production, releasing into the circulation. So excessive production of T3 and T4 by the thyroid gland in response to large doses of iodides, and this occurs because of long-term deficiency of iodine in the thyroid gland. Another risk factor is patients with multinodular goiter or nodular disease, patients with autonomous thyroid tissues where the thyroid gland functions autonomously, producing excessive T3 and T4 into the circulation. So autonomous thyroid tissue leading to excessive T3, T4 hormone production leads to Jod Basedow's phenomenon or hyperthyroidism, and this is induced by high iodides such as amiodarone, the drug which contains large amount of iodine, contrast dyes, or post-exposure to CT scans or angiography. So what is the management of Jod Basedow's phenomenon? Firstly, stop iodine exposure because iodine induces hyperthyroidism or Jod Basedow's phenomenon. Secondly, symptomatic relief can be achieved by using beta blockers such as propranolol, which controls symptoms such as tachycardia, palpitation, heart rate. And thirdly, anti-thyroid drugs such as propylthiouracil, methimazole can be administered because these drugs reduce the thyroid hormone synthesis, decreasing the T3, T4 hormone production, and controls hyperthyroidism. Lastly, if Jod Basedow's phenomenon is persistent, then definitive treatment such as radioactive iodine treatment and surgery can be considered in the management of Jod Basedow's phenomenon. Now let's have a comparison between Wolff Chaikoff's effect and Jod Basedow's phenomenon. In Wolff Chaikoff's effect, there is hypothyroidism which is induced by iodides. But in Jod Basedow's phenomenon, there is hyperthyroidism which is induced by iodides. Secondly, there is inhibition of thyroperoxidase enzyme leading to hypothyroidism in Wolff Chaikoff's effect. So, inhibition of thyroperoxidase enzyme leading to hypothyroidism in Wolff Chaikoff's effect. Whereas in Jod Basedow's phenomenon, there is reactivation of dormant thyroid tissue. So, the thyroid tissue gets autonomously reactivated and produces T3 and T4 hormones. Now, the Wolff Chaikoff effect occurs in normal individuals with intact regulatory functions. So, the regulatory function of the thyroid gland is intact, and this happens in a normal individual. Whereas in Jod Basedow's phenomenon, the thyroid gland independently functions, there is autonomous functioning of the thyroid nodules leading to excessive T3 and T4 hormone that are released into the circulation. Lastly, Wolff Chaikoff effect is self-limited, that is, the effect lasts for 1 to 2 weeks because of the temporary inhibition of thyroperoxidase enzyme, after which the thyroid hormone production resumes. Whereas in Jod Basedow's phenomenon, there is persistent hyperthyroidism which needs treatment. Now let's discuss the use of iodides in the treatment of hyperthyroidism. Iodides are used for the treatment of thyroid storm, which is a medical emergency which requires immediate reduction of T3 and T4 levels, and iodides produce rapid action, immediate action, drastically reduce the T3, T4 levels, and the action is produced within few hours, and therefore it is helpful in an acute setting like thyroid storm. Secondly, iodides are also used for pre-operative preparation for thyroidectomy, surgery or radioactive iodine treatment. This is because surgical manipulation of the thyroid gland causes rapid release of T3 and T4 into the circulation, leading to thyrotoxicosis. So, iodides, by inhibiting the release of thyroid hormones into the circulation, is useful as a pre-operative management for thyroidectomy or surgical treatment of thyroid gland.